Hey everybody, welcome back to another episode of the No Easy Way Out podcast. I'm Tony, and this is
Zach Snyder.
we are back, baby. We are here to bring you another great episode today, and we are excited about our guest today. We are joined today by James Gray. James, you're from Brighton. Why don't you tell our audience a little about who you are and what it is that you do?
My name's James Gray. I run the Michigan Institute of Athletics and Scorpion Fighting System, which is a professional combat team. We compete in jiu-jitsu, boxing, mixed martial arts, all over the world. We have people that are ranked in the top 10 on the planet for their sport.
Wow.
But we train everybody. We have a full-scale mixed martial arts and fitness facility. We have hot yoga built in. We have fitness classes. We have a nutritionist on staff. We have massage therapy. We have self-defense classes. We have private lessons. We have small group training, boxing, kickboxing, jiu-jitsu, wrestling, taekwondo, circuit training. Pretty much you name it, we offer it at our facility. We have just under 13,000 square feet in Brighton.
Wow. So basically you train guys like Zach and I.
100%. So if tonight you showed up at my academy and you're like, hey, we want to get started with jiu-jitsu. Mm-hmm. We have a fundamentals program. I would actually be your coach. You would come in and we would start from the basics. Yeah. So I run three things at the facility. I run the kids program, I run the professional fight team, and I build the fundamentals for people, because if I can give you a good base, it's easy to kind of keep you growing from that point.
Gotcha. So I'm 21 years old. I've had a desk job for 2 years now, and I've gained a lot of weight. So how would you start with someone like me, someone who obviously you can see is, not in the best shape?
You're fight ready, Zach.
I haven't had a workout in probably since high school,
He's not quite ready to put the gloves on just yet.
So where would you start with me, I guess?
I would look at it this way. It would depend on your confidence level. If you were willing to just jump right into a jiu-jitsu class and say that, hey, I don't need to be at my pinnacle physical conditioning to start a program, because you don't. You know what I mean? If you had the confidence to just come in, you could literally jump into a jiu-jitsu class, and we would partner you up with people that are experienced that would help you get started, start to learn the basics, start getting your body moving again. Mm-hmm. It's going to be tough at first. At first, you're going to be out of breath. Right. You're going to be going, oh my God, this is whooping me. But
it's like soccer practice all over again.
Yeah, but quickly you make progress. You know what I mean? So as long as you had the confidence to do that, we'd start you right like that. But if you were first coming in and say, hey, before I jump right into like a martial arts program, let's just get started with a fitness program. Let's get me moving, get my body going, get my lungs opened up. Then we would put you in a basic fitness class.
That's what I need, yeah.
We have a class called Punches and Crunches.
Jazzercise.
We don't offer that. We have a program called Punches and Crunches, where literally you're putting on boxing gloves and professional fighters run the class, but you're just starting with bag work on, bag work through rounds and a little bit of core exercise, and it kind of builds you into the condition where you're like, all right, I'm feeling better, I'm losing some weight, I'm ready to take on the next step and maybe try a martial arts class.
And you're wearing I think I noticed you're wearing a black belt today, right?
I am, yes.
Yeah, see? He's already started. He's a black belt.
He's ready to go.
He's ready to go.
At that point, I don't know if I hire him or we put him in the class. I'm not sure how that goes.
Am I a teacher or what?
I think he should start day one as a trainer. Okay, so I think Zach's ready, and I think we're ready. I think we're going to have a showdown, a throwdown maybe, as you would call it, here at AZ. Zach versus Tony.
Man, I train Tony or Zach, and then we put one of my other coaches in charge of the other one, and at the end of like an 8-week period, we have a boxing match or something like that. We could get people fired up, sell some tickets, get some sponsors on board.
We'll sell merch. Yeah,
we'll call it.
Make it happen.
We'll call it the Dad Bod versus the Lad Bod.
Lad Bod.
There you go. Dad Bod versus Lad Bod.
I don't know much about marketing, but I think that was spot on.
That's a hit. Yeah, that's a hit.
Stay tuned, everybody. It's going to be the fight of the
Garrett
week.
Soldano was supposed to come out. You were there. You witnessed him
He
say
chickened out.
that on Tuesday morning at 9 a.m. I'm going to be at your place. So I drove over 3 hours to be at Newaygo, and I was on point. I was on time. I did the podcast, and he said to me, hey, I'm going to be at your studio 9 a.m.
I thought he
Tuesday.
went.
I was there. I had my coffee in my hand. I had mitts out. I was going to say, hey, do you want to train some jiu-jitsu with me? Do you want to do boxing? What would you like to do? But he had to bail on me last minute. So I don't know, Garrett. That's one strike in my book.
That's on you.
Garrett, you just got called out.
That's right.
Got called out.
You better step up, man. You better step up. What would your former linebackers have said to you, knowing that you chumped out on that one? I'm just going to call you out right now. All right, so you are a gym owner, and we know that gyms were not deemed essential by the government. So when did you officially have to close the gym? What was the date? Do you remember?
So pretty much as soon as things started, unfolding in the nation, they were talking about quarantine and everything, we took action right away. I think it was March 14th or 15th. Don't quote me on the date. It was one of those days, but it was right in the beginning.
Yep.
And they said, this coronavirus is spreading across the nation. We want to take caution. And I wanted to do the same thing. So my girlfriend has an autoimmune disorder. So it made me nervous right away because I'm like, wow, this could be something that could cause major issues for her. So shut the gym down, close everything down completely. And I didn't even see her for a 6-week period.
Wow.
I avoided her 100%. She stayed at my house and I just didn't go there just to make sure that like, hey, if there's this horrific viral respiratory infection spreading around that has a high chance of killing people, 3 to 10% mortality rate, they were saying. I was saying, man, there's no way I'm going to put her in danger. Right. So I locked the gym down. I took all the precautions and all the steps and just kind of started going to work on studying this event.
Well, today is Friday, June 12th, as we're filming this. I don't know which day we're going to air it just yet, but it's Friday, June 12th today. And as of now, gyms are not allowed to open until Monday, June 15th, as just announced by Governor Whitmer here in the state of Michigan. A lot of other states have already opened gyms. I don't know if others have not. But what have you done that's a long period of time from March 14th to June 15th. What have you done to stay afloat? Like, I mean, you're a business owner. How do you survive?
Yeah, so my fixed costs, just my insurance, my rent, utilities, the basic fixed costs are almost $10,000 a month.
Wow.
So, because we operate a mega facility.
Yeah. Mm-hmm.
So all of a sudden you flip things off like a light switch, it gets real bad real quick.
Definitely, yeah.
Amazingly though, many of our members, well, I shouldn't say many, it was less than 50%, but many members were willing to maintain their membership even while the academy was closed. They were like, you know what? We want to donate that money to the school. Even though the facility's not open, we want a place to come back to when this is over. We want a place for our children to still train, our family to gather. We value what you do. And they've seen my track record. Over the course of a decade, I've always tried to do the right things by people. I've tried to, do as much as I can to help everybody. So it almost felt like karma coming back a little bit. So a lot of people were able to still, pay a little bit. Very, very later, I think, right before June, GoFundMe got started and some money was donated to that that was able to help. So we had to just do anything possible to get by. We had to find any way that we could to make sure that our landlord would get paid. And amazingly for me, we had discussions with the landlord initially where I was like, man, I don't even know if this will be possible. I don't even know if we can open back up. If I'm, $20,000, $30,000 in debt and like my membership numbers spike and I'm down to a 20-30% of what I was operating at before, I don't even know if it's possible, right? So luckily, only in the last week, my landlord and I came to an agreement where I'm going to pay like a lot of the money that's owed over a long period of time, like spaced out over almost a year period. So it makes it feasible as long as we can get back up to like our normal operating level. Yeah. And a lot of my coaches and stuff have stepped up and been like, hey, we'll coach for free for a couple months to just like get our program back because they understand what we went through. So it's been a huge effort of a lot of people coming together. But I think there's, I see the light at the end of the tunnel type deal where the coronavirus is just going to be kind of a nightmare in the past.
Yeah.
Although we're still living through it. As you said, I'm not supposed to be open as of right now. And to be honest with you, if you look at the rules and regulations, I don't know if our facility could ever open again. Think about this. Like in jiu-jitsu, I am physically on top of another human being, sweating on them, breathing on them. We're as close as you can possibly be without maybe being intimate with someone. You know what I mean? And I mean, for example,
and it depends on if they buy you dinner first.
Yeah, absolutely. I mean, it really depends on how the night was going. But I mean, last night alone, we had almost 40 people all doing jiu-jitsu at the same time, packed into an area, training. I mean, that's a part of the sport. And throughout human history, there's been wrestling and jiu-jitsu and personal interaction. Like, we've always known that with an immune system, there are viruses and bacteria in the world, but it's good to interact with them. It's good to literally touch things and touch your mouth. Like,
that's how your immune system fights
your
it.
immune system strengthens the way that, like, how when you want to build your muscle, you go to the gym and you
I don't know
make
much
it
about
work.
that, but I've heard about it.
That's the concept is, you know what I mean? You have to allow these processes to function. If I lock myself in a bubble, I Lysol everything around me, I don't interact with any germs or bacteria, I'm going to at some point. Yeah. And as soon as I do, I'm going to be less prepared. Just like the first time you jump back in the gym after saying, hey, I've been out of it for a little while, and you go to run a sprint, your body goes, what are we doing here? Right. Oh, my God. You know what I mean? It's the same concept. People
Zach, when's the last time you ran a sprint?
Couldn't tell you. I don't know.
He did play
the
alumni game?
The alumni game, yes.
I wouldn't say you sprinted in that.
Well, I moved.
We had an alumni basketball game. Yeah, he did.
Yeah.
He hit a huge clutch three, and then we pulled him out and said, let's just drop the mic there.
That's the last time playing basketball ever again.
Yeah. He finished with a three.
Go out on a high note. So you're open right now, would you say?
Yeah.
You are,
So
okay.
we opened actually May 4th. in the
May the
morning.
fourth be with you.
May the fourth be with you. I am a nerd, and it wasn't chosen for any reason other than as of.
But you were the chosen one, though.
Yes.
There you go. As of April 14th, I had compiled enough information, spoken to enough people that were leading. I spoke to doctors, spoke to state representatives, spoke to ICU nurses. I've studied this subject matter like I've never studied something in my entire life, and then referenced and corroborated that information with experts. As of April 14th, if you go back on my Facebook, you're going to see something funny. I put like a weird emoji status, which had like a waving hand, it had a middle finger, it had a fist, it had peace signs. And what that broke down to, everybody was trying to figure it out. I had all these people messaging me like, "What, James? What are
Cryptic
you
message."
saying? What is this encoded message we're trying to decipher?" All it broke down to was 5/1/2020. I'm done listening. Like, you're gonna see. Like, I'm making a deal to this.
Yeah.
And as of May 1st, I put out that video. That 20-minute video got censored by YouTube, got taken offline. The funny thing is, I was saying things that may have been a little bit ahead of their time that have now been all proven to be accurate.
Right.
But at the time, it was deemed like, you're not allowed to say that. They took my video offline. That was me saying, listen, I'm going to open this facility, but I would like to be judged fairly, and I want to lay out the reasons why I'm opening my facility so that the people around me see that I'm not just some terrible human being that is trying to kill people in my community for money, okay?
Right.
So that was my attempt to lay things out, right? And YouTube took that offline, which was like such a shock to me because, as I've said before, there can be every conspiracy theory you can think of can be online. There's
Right,
conspiracy
yeah.
theories that say George Bush was directly involved in taking down the Twin Towers on 9/11,
right.
and that can be online. The KKK can be online. The Westboro Baptist Church can be online. Porn can be online. But James Gray going over information that he is openly willing to debate with anyone, right, is not allowed to be online.
Yeah, that's
that was an
crazy.
interesting thing. You know what I mean? So I put that out, and I said, listen, May 4th, I'm opening my doors. And I did it in a way out of respect for my community to say, I'm not going to open the doors to the general public, but I'm going to allow all the members that have stayed by me to have a place that they can come and take care of their physical and mental health. And then after that, once we've done that for the month of May, I'm going to open to the public again on June 1st. So I'm going to let anybody be able to come in. And that's where we're at now.
So why did you think it was, morally right then for you to open up when the governor said it was illegal?
Yeah, so it's a really difficult decision to make. So she deemed my life's work unessential.
Yeah.
And that was a shocking thing. You know what I mean? I've never thought of myself as unessential. I thought of, like, I've poured my heart and soul and everything I've ever built into
Right.
the people around me. I work with the local court system to help struggling kids. I've helped a lot of people achieve their dreams. So I consider my life's work very essential. But I understand that if there was an actual crisis where you had a 3 to 10% mortality rate, a virus that was killing people, I would make extreme sacrifice. I would not want the people around me to pass away, because I was trying to just do jiu-jitsu, right? But the way I was able to make a decision like that is when I laid out all the information and I saw that, wow, this is nowhere near the reality of the virus. This is a story we're being told, which is not shocking to me. It's not shocking to me that the media may sensationalize something to have a dramatic effect. It's not shocking to me that when trillions of dollars are being moved, the largest sum of money in the history of the world of politics was moved during this time. $3 trillion initially, and then more and more and more, right? Like it was a proposal and then added and added and added, right? When money like that is moving around, when all these things are taking place, I'm not shocked that things get a little bit overly amped. But when I had dissected the information, when I was looking at, like, the 3 to 10% mortality rate is what scared me the most initially, because I didn't know, and I'm like, that is devastating.
None of us knew, yeah.
That is devastating. But then I said, like, where did that number come from?
Right.
And when I started to take it apart and I realized they just took hospitalizations and deaths and made a statistic without taking into account asymptomatic people, mild cases, moderate cases, people that didn't go to the hospital.
Right.
Everything that you do for every viral infection throughout history.
Right.
And they didn't take into account that we had over 50 years experience with coronaviruses, more than that, 60 years.
Yeah.
So, and coronaviruses were just flu-like symptoms. They were often more mild than like a bad influenza. So, okay, you throw that out the window. Okay, you throw out all these other things in the name of caution. I am fine with that. But then my question became, as soon as the data was available and you have all these blood work studies and people saying, listen, we are far from reality on this, why were we not instantly trying to shift the narrative of like, oh, thank you all for playing it safe. Thank you for quarantining. Thank you for caring about your citizens and stuff. But we need to have a scale right now. And while we are putting over 30 million people on unemployment, while we're creating all this damage and poverty and suicides and stress and domestic abuse and sexual abuse and all the things that we're starting to ramp up. That's on one scale, right? Caution can't be the only judge. You have to rely on reality. There was a theoretical threat, right? Which is what we all reacted to. But beyond theoretical, you need to get to the reality. And when I broke that down and I saw the reality, and like I said, I made sure to corroborate with doctors and all the people. So I started calling friends that worked at the ICU in Detroit in the hardest hit areas. I got one of the nurses on a podcast with me, and I looked at her halfway through the thing and I said, hey, I've heard reports from Sparrow Hospital, from someone I know personally, from a Illinois public health director on ABC. She said that in many places we are classifying a COVID death as anyone at the time of death with a positive test as a COVID death. That would be so corrupt, because that would take us so far from the reality of the virus. If you shot me in the face right now and I had COVID in my system, but I was asymptomatic, that's not a COVID death.
Right.
That's you can't even pretend that is, right?
Yeah.
So when I started to discover all these things, and like I said, I brought that up to her, and I said, obviously we're not doing that, right? And she gets this like, and she goes, we've been instructed to do that way. I don't know why, but we are. Then I'm like, okay.
Right.
We're not even operating in reality anymore. This is, and then when you look through the CDC and you can't find COVID deaths without all presumable cases being lumped in, you know what looks a lot like COVID? Many respiratory infections. You know what else does? Influenza. You know how many other things can be factored in? So today's date, right before I got here, from February 1st until today's date, the provisional death count for COVID, including every presumable death. So they lump it all in together. Now remember that many places are classifying the things that I just talked about: car accident, COPD, heart disease, stroke, anything. You simply have this widespread virus, you're going in that number. It was 97,000. So if we Googled it right now, if you want to pull up CDC provisional death count COVID-19, you'll see 97,000. At the same time, from February 1st until today's date, 1.1 million Americans died. So you have to create perspective. So when you look at COVID, take that 97,000 number. Now take out all the deaths that weren't from COVID. The virus was just simply in their system. Yeah. Now take out all the ones that we never even ran lab work. You didn't have to. You could just throw them all in that number. Maybe that number's down to 60,000 or 50,000 or 40,000 or maybe less. What does that sound like? A seasonal viral infection. Yeah. Influenza in America kills over 60,000 some years. One thing I kept bringing up to people that tried to open their eyes to the perspective is the 2017 flu, per the CDC, hospitalized 959,000 Americans and over 60,000 died. If I took those numbers and I presented a stat to you, that's over a 6% mortality rate. Yeah. So that means we should lock down every single flu season. That means this November, as soon as you cough, I should panic. We should shut all the businesses down. We should lock people away. That's not reality. Okay, if we could eliminate threat from the world, we should do that, man. If I could make sure that people wouldn't die, I would do that.
Sure.
But just under 2.8 million Americans die every year. I drove here in a car. I drove here an hour. I took a certain risk on my life. Every time you do anything, you take a certain risk. Right. So if you really care about your health, you got to take care of your health. You got to do things for your physical and mental health. You got to try to inform your family and people that are struggling.
Right.
But you got to be intelligent. So once I created perspective, I said, hey, we need to throw this thing out. We need to be intelligent, but we need to not lose our life's work and other things like that over something that is just not what it was presented.
Yeah, at some point I think you have to allow people to understand the risk, make us aware of it, give us safety guidelines to prevent us from. I'm good with all of that stuff. If you look on the side of the pack of a pack of cigarettes, it says if you smoke this, you're going to get lung cancer and you might die. People understand the risk. They take it. Many do die. Many do not. But it gives them the opportunity to say, hey, we warned you, but here's the risk you're taking. And just like you mentioned, there are many things that we do that involve risk. And I'm of the mindset that if there's something that I can do, just as you mentioned, that would prevent somebody from being at risk or prevent somebody from getting sick or prevent somebody from dying, I'm all for that. I'm all in. But when it gets to the point where you realize that what I'm doing is not actually preventing. When this all thing first started, my 10-year-old daughter, this was in the first couple weeks. When it first all came around, I was like, this isn't real. This is a bunch of media hype. This is going to go away. It's the flu. You didn't know what to believe. And then my daughter started having chest pains and a little cough and low-grade fever. And at that point, we didn't even know what the symptoms for coronavirus were. I had known I've heard of coronavirus before, well before 2020. I'd heard of it. It's something that's been around for a long time. But COVID-19 was this new thing, and of course you're getting all these numbers that kind of make you freak out. Like, but even then I was like, it's not real. I mean, I was one of those. Well, then your daughter gets it, and well, they think we call to say we want to get her checked for strep throat because that's what it seemed like to us. And they said, oh no, with those symptoms she can't get checked for strep throat. She needs to go right to the COVID testing site. So they take her there with my wife. I'm not allowed to go, only one person. They said the hospitals were overrun. Our hospital only had like 6 people there the whole 2 hours my wife was there. And then they test her, and it was a very invasive test. And then we had to quarantine for 2 weeks. I mean, and we did. We stayed indoors. We didn't go around anybody. My father is asthmatic and, has heart issues. And so I was like, I'm not going around my dad because they told me what kind of person would I be to expose my father to this or to my mother. And, my parents are wanting to see the grandkids and we're just confused, but we did the whole thing. Well, then they call us and say the test came back negative. And since then, we've been told now that a lot of those initial tests were false negatives, and they want her to come back in and get tested again because they think it actually is positive. And I said, I'm not bringing her to the doctor to get tested. She's not sick. And so all along, then there became this, like, it just didn't add up. It just didn't seem right. But I don't know that any of us really know what the deal is. You've done a ton of research. I can't say that I've done the research that you did. So what confidence did you do? I mean, you mentioned some things, but how do you get to the point where you say, I'm so confident in what I'm doing that I'm willing to open up despite the stay-at-home orders. I'm willing to let people expose themselves to close physical contact and know that I am not personally putting their lives in danger.
So I don't think there's ever a way to speak on the 100% to that, to say that I know for a fact that I'm right, because if you did, that's already closed-minded, and I try
Right.
to never be closed-minded in life. But I had compiled, so I had a list. I should have just brought my list with me today. I keep a journal on almost a lot of things that I do in life. I have a big journal, and I write everything down, and I like to, check things. I have 27 different things that I had listed out that I confirmed with doctors and spoke to other people, that when I laid it all out, it was so hard to be like, okay, with all of these things that are backed by data, that are backed by experts, that are backed by the science of the world, like throughout history, I said, we know we have an immune system. Mm-hmm. That's a basic. We got to the point where people were so afraid, they were letting go basic thoughts that I thought everybody knew. Like the common thing that I heard a lot, I got into actually an online debate with a nurse who said, James, what you don't understand is there is no cure for the coronavirus, and it's a novel thing. But I want to break down those two things because I've heard a lot of people be scared by that. So no cure. Your immune system is the cure for viruses. Okay, and when I say that, what is a vaccine? Because a lot of the people that had the no cure, they just wanted to wait on the vaccine. Mm-hmm. The vaccine is just a certain amount of the virus and a certain viral load that will trigger the effects to make your immune system respond.
Fight it.
To produce the cure.
Yeah,
You're synthetically.
The one time I got a flu shot in my life, which is just a small dose of the flu, I had the worst case of the flu that I've ever had, and then my immunities fought it, and I have not had a case of the flu since. But it doesn't mean that. I mean, what I'm saying is it gave me the flu.
100%.
And they even told me it might happen.
And the goal is, they're trying to scientifically figure out, like, what are the chances that we can get the immune system respond without you suffering from the actual effect, which you basically just got the flu and then you cured it naturally. You know what I mean? So I've never had a flu shot in my entire life, and I don't get the flu. I don't get it.
Right.
So with that being said, I had to go back and be like, people don't even understand that your immune system fights virus. Like when you were a little kid and you got sick, like, remember when your grandma or your parents would give you a blanket and they'd throw you some chicken noodle soup and you'd sweat it out? The idea is, like, with most viruses, you don't treat the virus. You give the body what it needs so that the body, using its B cells and T cells, can produce its antigens, and it learns the immune response for that virus. So that's how we do antibody testing, is because we can look at your IG levels and we can go, oh, you have the IG that shows that you came in contact with coronavirus and you have the immunity built up. So with that being said, you have nurses going, there's no cure. Now, if you don't know the words that I just said, sitting at home, you go, if I get coronavirus, there's no cure. I'm going to let you in on a secret.
I'm going to kill my parents.
You are the cure. And the beautiful thing is herd immunity and many other factors of this amazing microbiology that we have helps keep the species alive throughout time. When you do things like lock everyone at home and keep people away from each other and we're not shaking hands and we're not interacting, we are slowing miracle effects like herd immunity. Therefore, we're going to create more of the high-risk population having to produce the immunities themselves because we didn't have the young, healthy adults and children interacting, spreading it real quick, producing immunity, and stopping that virus's effect on the community. That's how that works. That's how herd immunity works. So we slowed down that effect, keeping the virus way deadly for a much longer period. And the rationale behind that was flattening the curve. Everybody remembers flattening the curve, right? The only theory for flattening the curve was to make sure the hospitals weren't overrun.
Right.
Our hospitals never got overrun. Very few spots in Michigan had, you know what, it got a little crazy for a minute, especially due to the chaos. You were driving all these scared people to the hospital, but we never got to this war zone that was supposed to be coming. I read headlines that said there was an apocalyptic surge going to happen. Right. It didn't happen. During the pandemic, Beaumont, Wayne, so there was 3 counties in Michigan that had 88% of the cases.
Yeah.
Beaumont, Wayne closed. They were the COVID hospital. Yeah. They shut down during the middle of the pandemic because they didn't even have enough people in the COVID hospital. Right. With that being said, I need to have my business closed, lose all of my life's work, and you can't even keep the hospital open?
Right. But many would say that's because
of the social distancing.
Yeah,
but
It worked. We did what we were supposed to do.
So the beautiful thing to counter that argument is antibody testing would then show that the virus has not been widespread. So all of the antibody testing that has been done, Stanford, University of Southern California, New York, 2 places in Massachusetts, and many since, and including they did prison population tests, military tests, tests on the homeless population, all of them have shown that the virus is so much more widespread than being reported, to the point where it almost shows that our lockdowns had little to no effect at all in stopping the virus from spreading. Now, that's going to be a hard reality to swallow. If that is proven undoubtedly true, we're going to show that all of the damage, all of the chaos, all of the lives lost that were extra, all the businesses lost, all of the people's life savings. And I mean, there's businesses that went under that will never return.
Well, I know of a couple personally that permanently closed. And there are some that are still on the verge of that, even though they're starting to open things up. They don't know that this 50% occupancy that they're allowed is going to help them, because some businesses, particularly restaurants, can't survive on 50% capacity. It's almost better to stay closed because the staff that you have to bring in and the cost of the goods and all of the different things that go along with that, 50% doesn't cut it. So we're still not out of the water on that, and we're going to see how much the long-term effect this has had on people.
You just hit on a really, really important topic that I think people need to take into account. People are still reacting and creating policy based on the initial fears and like the fear that swept the nation, that created everyone to panic, and the 3 to 10% mortality rate, and this virus is coming to get you. There's no cure. It's novel. I didn't even touch on the novel thing, but it's only novel in the way that it's just a new strand.
Yeah.
Okay. I mean, there's coronavirus. This next season of influenza will probably have a novel influenza. But don't be scared by that. It's just things change over time, and then the body adapts, and human beings can adapt, right? So with that being said, you had the theoretical threat that terrified people, which we all took caution, and I'm so fine with that. If we would have for 6 weeks shut down, and then when we came out of it, we were like, you know what? Now it's time to look at data. Now it's time to be intelligent. And then when we look at that, we're going to make all of our decisions off the data, because we're not talking about theoretical. Theoretical doesn't matter. What actually took place matters, right? The problem is we're not. We're still reacting as if there's this horrible thing that if you go out in public, the fact that I shook your guys' hands today, this could be my last day, right? That right now is still driving policy. And it could be driving policy for a couple different reasons. I don't want to speculate to why. But now, like you said, you're going to put businesses in a situation where they may not be able to survive because of a boogeyman in the closet, where we should be opening the closet right now, flipping the light switch on and going, wow, thank God it's not what it was supposed to be. Well, thank God.
Well, the truth is, it might be your last day.
Yeah, it could.
It might be.
Yeah.
I mean, and it could be for a lot of different reasons.
Sure.
None of us are guaranteed. The only thing that all humans are guaranteed is death.
Sure.
We all experience it at some point. And not to say that we shouldn't do things to avoid it and do things to be careful, but we don't know when our last day is. And so if we are just trying to avoid death completely, then we probably should wrap ourselves in bubble wrap, go in some cellar,
and time will get you
just
anyway.
Enough food to survive as many days as possible. But, we have to understand at some point that we have to be able to make decisions, be careful. I'm not at all suggesting that coronavirus isn't real. I believe it
No,
is
I've
very
never
real.
suggested that.
And I'm not denying that it has killed people and that
Sure.
it will still continue to kill people. What I'm saying is that now that we understand it more and more, I think there is enough things in place where we can practice safety and be around each other in a safe way, and that we can start to make decisions based, and then people have to at some point be able to take their own risk.
Yeah.
They understand the risk. If you decide that you're going to ignore things that might make you more susceptible to catching a virus, then that's really on you.
Sure.
And I can't, if I did, let's say I decide tomorrow that they open up sports again or whatever, and I go, let's say this fall, I go to a football game at Michigan Stadium. I'm a big Wolverines fan.
Yeah, you took a risk. Yeah.
And I get coronavirus from somebody there and die.
Sure.
That's not on the person I sat next to. That's on me. And I can't blame that person, nor, I that's on me for going there. And I think at some point we have to get to that point in society where we realize, man, and the truth is too, if you've been out in the last 6 weeks, 8 weeks, 12 weeks, I guess it's been, if you've been to Meijer, Kroger, Walmart,
Which almost everybody has.
if you've been to the gas station, if you've had something delivered to your home, if you've ordered food. I've been to so many restaurants where the people aren't wearing masks and gloves, they're preparing the food. If you've had food delivered to your home, if you've had Amazon delivered to your home, people's hands have touched that. Unless you are, completely disinfecting it all. And I know some people have gone that measures. I know of someone that will have something delivered and they'll leave it in their home for 3 days before they touch it. So, I mean, unless you're willing to take those extreme measures, I think we've all been exposed at some level to it. And I think that at some point we have to be able to make educated decisions for ourselves and decide, let's be safe, but let's get back to...
And again, let's look at the numbers, because 2 young, healthy adults and children, this is a virtually non-existent threat compared to almost everything that's out there. Like influenza, like H1N1, killed over 1,200 children in this country.
Yeah.
If coronavirus had killed a fraction of that, it would have been the number one thing on the news, because that would scare you the most. Nobody wants to think that their child could pass away. So you have to be honest. You have to say, okay, when we put coronavirus into perspective, it is pretty standard for a lot of things that can happen in this world. Yeah. It's not even killed more than a pneumonia. Pneumonia is something we had forever. A bad influenza takes out about just as many as coronavirus. Because you have to take out all the fake coronavirus things. Influenza infects up to 40 million people a year on a bad year. So imagine if everyone at the time of death that had influenza was counted as influenza death.
Right.
That number would be in the millions.
Yeah.
You'd be shaking when you leave your home like, influenza's out there. We have to be intelligent. And this brings us to another question, is the protests now and the riots. It won't matter if cases jump up, because I've seen some news stories start to say cases are increasing. We're going to test a lot of people. It's a widespread infection. No big deal. If deaths, remember everyone tried to scare you with the 1918 plague. What happened was we opened too early and there was an apocalyptic death surge. First of all, if you're trying to compare coronavirus, which is struggling to hit 6 figures, even with the highest inflation we could possibly give it, to a 1918 pandemic that killed 25 to 50 million people in a time where the world had 1/3 of the population. So let's roll that forward. That's 75 to 150 million you're trying to compare this to. First of all, that is so far from the realm of reality. But even if you wanted to do that, that means as soon as we open back up, we should have saw another massive death spike. And what I'll tell you is, you're not going to see it. And if you see it, you're only going to see if heart disease and everything else, if all those people are dying at a normal rate like they do. Like I said, just under 2.8 million people die a year. If you have places that continue to include coronavirus in any death, fine, you might see that. But when you don't see that death spike, that leads you more to the truth. And then all these things as they come out lead you more to the truth. Yeah. Why are we not against protests? Our governor was outside walking down the streets right side by side. And we were all supposed to be so terrified. I wasn't allowed to be within 6 feet of you at a store, even if I had a mask on, even if, we're going to touch the exact same things. Right. You might have touched a product. Yeah. Don't do that or you might kill someone. Right. But we can protest in massive bands of people on top of one another. There's some questions.
Yeah.
There's some questions.
Well, I think that's the key is, if you're listening, you just need to ask questions.
Of course.
You need to ask questions. It's not my opinion. That's for me. It's James's opinion is for James. Zach's opinion is for Zach. You have to come up with your own opinions, but it is always smart to ask questions and to look at the facts and to look at the data and then come to your own conclusions. Listen to today's episode. I don't think I'm trying to proselytize, win people over. I don't know that James is trying to do that. He's just explaining why he did what he did and why I've done what I've done. And it's up to you to make those decisions. And if you feel compromised or unsafe, then you can still stay home, distance,
100%.
all of the things you can. And I would recommend it if you feel like you're vulnerable.
And I've said the same thing. I've actually tried to tell people, listen, I'm trying to put information out there. And I would challenge you to try to disprove any of this information. Don't ever believe a word I say. Go look into it. Because when you look into it, you'll find the truth. Like, that's a very powerful thing.
Right.
You know what I mean? You need to
And
try to
Facebook
seek,
research doesn't count.
No, you have to speak to experts. You have to study. You have to look at the CDC. You have to look at the subject matter in general. And then when you get closer to the truth, you'll have a better ability to make good decisions. And I support, like, throughout time, when we know a high-risk group exists, we do things for that high-risk group.
Yeah.
Like young, healthy adults and children, there should be very little things, right? But with that being said, if you want to take precaution, if you want to wear a mask, I support you 100% in that.
100%.
If you don't want to go to certain places, I support you 100% in that. I support your ability to be a free citizen that makes informed decisions. You
Right.
alluded to earlier, smoking kills people. Alcohol kills people. Depression kills people. Influenza kills people. There's a million things. If you care so much about people that you want to try to make the world a better place, look at your family members and find the people that are struggling with depression, the people that have alcoholism, the people that are smokers. If you want to save more lives than whether or not they ever come in coronavirus, just do better for your people, for your family, for your community. But no matter what, we back your rights.
Right.
You know what I mean?
Well, that's the key. We have to support each other. You know, if you're a business and you've decided to stay closed, I fully support that.
Same here.
If you're a business and you've decided to open and that's what's best for you and your family, I fully support that. I don't know, and as our businesses here in town have been opening, I go and support them as much as I can. Last 2 Saturdays, my wife and I walked through the farmers market and walked through the downtown and tried to spend money at every single place we went to. We've been going this week to all the different restaurants that are opening, trying to, number one, because we love to eat. I mean, look at us. But number two, we're trying to support them. But I also support the ones that feel like they're not ready yet.
Same, man.
And I think that's the key is we have to, number one, have conversations with each other. We have to listen to each other. We have to support each other. We cannot turn this into me against you.
We're all in this
because
together,
that,
man.
to me, that whole idea that now we're going to be pinned against each other. I went to a store up in Petoskey 2 weeks ago. Wasn't wearing a mask because it wasn't required. It was in a Meijer store. And I walked past an elder lady, wasn't close to her, me and my brother-in-law, and this lady yells at me and says, "I can't believe you're not wearing a mask." And I turned and I wasn't sure if she was something. I said, "I'm sorry, did you say something to me, ma'am?" I was very polite. And she goes, "Why aren't you wearing a mask?" And I said, "Well, I'm not sick and I don't feel like I need to wear a mask." She goes, "Why are you talking to me? You're not my husband." And I said, "Oh, I'm sorry. I thought you were talking to me. Why would I talk to you? You're not my husband." And then she took off running from me. Now, as a person like me, I'm very relational, that kind of stuff. And I thought to myself, is this going to be what society is, where we're afraid of each other? And I genuinely, that stuck with me because I don't want people to be afraid of me. And, I don't want to be afraid of other people. So I think that it's important that we support each other, have these conversations, and make sure that we're asking the questions and doing our own research and doing the things that we think are best for us without trying to be haphazard and causing other people harm.
Man, that's a bullseye because freedom is like one of the founding things of this country. But like love and respect for one another should be the second hand-in-hand thing.
Absolutely.
Like to value other people's rights and to really have a good culture, you need respect. You need compassion for other people, and you need the ability to, like, if I'm guaranteed rights, you should have them too.
Right.
So if,
Absolutely.
like you said, if all of a sudden we take this like it's us versus them mentality, when I try to walk in a store, if I'm not wearing a mask and you look at me as now I'm an enemy, I'm a bad person, that's not going to bring us together. It's
will
gonna,
not.
It's going to create chaos.
Well, let's get down, as we're getting close to the end here, let's get down to the real question. And that is, I'm out of shape, bro. So my wife and I, we belong to a gym called Fitness Coliseum. They have not been able to stay open through this. It is a boot camp style workout, trainer led. They're all classes. There's multiple classes throughout the day. Last July, they have a 6-week challenge. And there's a video actually that we produced. It's on my site. You can go watch it. But my wife and I took this 6-week challenge where we changed the way we eat, the way we go about our daily lives, the way we exercise. We commit to a certain amount of workouts
That's
every
awesome.
week. And we did that. First 6 weeks, I lost 31 pounds. My wife, and I gained 6 pounds of muscle. My wife lost almost 20 pounds. And then we kept doing it until about February. And between the two of us, we lost almost 100 pounds. Changed our lives. We were feeling better.
Wow.
We were feeling young. I'm a basketball coach. My sons are really into basketball. I was playing sports again with my kids. My energy level was high. I was feeling really good. My clothes were fitting better. The whole thing. We did it from basically July until end of February, actually right into March. Still working out, still eating right. We're feeling great, feeling healthy. I was 15 pounds away from my target weight, and then coronavirus hit. The gyms had to close. And I am such a all or nothing person, unfortunately. There's no such thing as moderation with me. And that's
Same.
And there's a fat kid inside. Like, it's always going to be there. I like to eat. I like snacks. I like pop. I like all of these things. And I never really realized that I was a stress eater until this all came on, because I handle stress differently. Like most people that are around me, when I have stress, it seems like I'm just blowing it. Like I don't react to stress in the way that most people do. What I find is I snack and I munch. Well, anyways, our gym owner she still did live classes like 8 times a day. Her and one other trainer were actually doing these classes, so you could go online and watch it. We tried to do it from home. We just aren't the type of people. We don't really have the space at home to do these types of workouts, because again, it's a mixture of cardio, Tabata, HIIT. There's all kinds of things, weight training, and so our home is not set up for it. So we stopped working out altogether. We should have been going for walks. We should have been doing things. We should have been eating right. Well, next thing you know, I'm eating unhealthy again. And since coronavirus happened, I have put on 30 pounds. Now, the gym opened up last week to outdoor workouts. So I started going back. I went 3 days last week, and I already I lost 8 pounds last week. And that's mostly just water weight and getting back on the right track. And this week, I'm already finding it's a challenge again, because working outside in the hot sun, and I didn't go for so long that my body's not used to it, but I'm still trying to do it. And next week, the gym opens up for indoor, so I'm excited about that. But the impact that it had on my body and my physical health has been, 30 pounds in 8 weeks is not healthy. If you gain that much weight that quick, that's not healthy, 10 weeks. So I want to know, what kind of things have you heard from your clients? For them, at one point you were only doing the ones that were existing, but what about the clients that couldn't come, didn't feel safe? How has this impacted them? What have you heard from them?
Honestly, it's almost the identical story that you just told. So many people said, hey, I tried to maintain my routine at home, but it's just really difficult. It's when you're at home, that's like your safe space, your place to relax, your place to unwind.
Right.
It's really difficult to get fired up. Like when you leave the house, you're on a mission.
Right.
You know what I mean? Like
and I sweat a lot, and I'm sweating all over my carpet, and like this isn't good.
No, of course.
Yeah.
So we heard so many of the similar things. We tried to launch some online programs, and we had some people take the classes online, but it's just not the same. Human interaction is so powerful.
For sure.
And energy is infectious. If you come to my facility, there is so much energy in the building every night, you could power a city. I mean, there's just energy radiating in the air. So they need that.
And that's what I like about the gym. I didn't think the gym we go to, I didn't think that I would like the group style workouts. But seeing other people around me doing the same thing, the energy's high, the music is high, the trainer's high, it really is addictive. And I'm looking forward to getting back into it. And I think that for me, people would say, oh, you just gained weight, you just lose it again, But to me, this had a significant impact on my health. I am feeling lethargic again, as busy as I've been. And you can ask my staff, I've been busier than ever during this time. I've done as many things as I can do to keep my business afloat, to keep my business relevant, to reach out to people to try to help. I have been extremely active and extremely busy, but I have not been physically active. And there has been such a toll on my physical health, shortness of breath, difficulty after, even climbing stairs. I'm breathing heavy, sitting there, getting lethargic, trying to stay awake, fighting, fatigue. And that, I think, is very real. And I think when you sit at home, or even when you're not able to do physical things, there is such a thing as a damage to your health beyond just a virus.
Absolutely. I mean, like I said, if you look at the death statistics in this country, I didn't know what they were.
Obesity
before.
is probably up there.
Oh my God. I had no idea that just under 2.8 million people die every year. And when I broke it down and saw what's killing people, it is alarming, because I'll tell you right now, most of what is killing people is self-inflicted.
Yeah.
It's choices people make. If we made better choices with our health, with the things that we do with our eating, our lives would be so much longer and so much more prosperous and better for us. But it's like you live in this box. You eat what tastes good. You don't
YOLO mentality.
No, for real. And but yet you panic to coronavirus But you don't panic to the fact that
Taco
your
Bell.
lifestyle choices, when you look at statistics and you see the alarming rate of human beings that are dying, the average is over 7,700 a day die in this country. And when you realize that most of that is self-inflicted,
Yeah.
it's unbelievable. So the things that you're talking about right now, if you really want to live a long and healthy life, forget the word coronavirus. That is not your threat. Your threat is the choices that you make on a regular basis. It would probably be, if you statistically broke it down, I bet you if you went to a building with coronavirus every single day in a gym, but you cleaned up your nutrition, you took care of your health, you worked out, you did all that, you drank more water, you did all those things, but you were going to be around someone with coronavirus every day, I bet you would statistically be way less likely to die still being around that person every single day than if you don't make the choices to take care of your health. That's perspective.
Yeah, and we are not, I think, as a country, overall healthy people. And I know,
Absolutely true.
I know here, he and I, we make bad decisions, regularly
Every day.
when it comes to eating and things. But I'm committed right now to get back on the right track. So I guess the question, Zach, what do you think? Should we get in the gym?
Well, I mean, all right. So there's
It'd
a
be
chance.
super cool. I would love to have you guys come out and have our professional fighters run you through some workouts. You
Yeah.
could bring girlfriends, wives. I'll even
I don't think we want anyone to watch this.
No, but I'm just saying, like, man, it'd be
Yeah.
great, and we could promote it. We could maybe even do a follow-up after and be like, you know what, we went in there, we were training, it was a blast, and we can talk more. We could do a whole podcast just on life choices and health and, like, how to bring
True.
people together and get motivated. Because I'll tell you what, if more people could just find that spark of motivation and discipline to do the things that deep down they know that they would like to do, you'd change the world. You'd
Yeah.
change the world so much better than
What do you say,
any
Zach?
dialogue could do.
Well, we might check it out like Garrett did, but there's always
Could
a chance that we
happen.
could do it. So-
Garrett, that's twice in one podcast
That's twice,
you got
man.
called out.
I think we should do it, Zach. I
Yeah.
think we should go to the gym,
It'd
put
be
the
good for
gloves
me.
on.
Yeah, oh,
we
yeah.
can make a video out of it if you want.
Yeah.
It might be a good
Man, it'd be
might be a good
Content.
TikTok.
We'll promote you. We'll promote us. Yeah.
Yeah.
I could put you each with a professional fighter and have them run you through a workout and everything, and then we could shoot a video and stuff together. It would be awesome. People that you watch
It would.
fight on like ESPN.
That's a good vlog. Yeah.
Yeah. We'll do it. Let's set it up.
We'll think about it.
Let's
You-
set it up.
You all just heard a commitment. You
Zach,
watched this video?
I'm in.
That was
I
commitment.
said I'll think about it.
I'm in. Zach's thinking
Zach
about
gave me
it.
a halfway.
But,
He was one of those, he set the excuse early on.
but here's the key. All I got to do is tell Zach he's on the clock, and he'll have to do it. So we'll be there.
That's called leverage.
That's
We'll
called
be there.
leverage.
All right,
good.
man. James, thank you for being on. So we could talk all day. I want to ask you this last question. What would you say to other people in your industry that right now maybe still haven't opened? I know my gym owner is an awesome person. Her name is Brianna Carroll. She sent an amazing letter to to our local representative. I think I sent it to you, just asking him, like, how can we get this thing open? Talking about her struggles. She's an amazing young lady. She's 25 years old. She's trying to do all the right things. She's not one that she doesn't feel confident that she can just break the law and open. But what would you say to other people in your industry as they're getting ready to reopen and they're trying to do things right? What would you say to encourage them?
I would just say, be as informed as you possibly can, be as educated as you can on the subject, really know your information, because, like, I don't know what action is going to come against you. You need to know your information inside and out. And beyond that, you need to create perspective, and you need to just do the best you can. You know your business. You know how people interact. You know what you can do, and you know what you can't do. And don't be unrealistic. Don't accept unrealistic terms, because some people are so desperate to reopen that they're accepting these terms. Like, I had someone call me on the phone, a business owner. I won't name them because I don't know if they want it, crying, saying, like, I am not going to be able to operate under these conditions that I was given to open up. Then don't accept them. And I mean that very boldly. Do not accept them, because if you just accept terms that are incredibly unrealistic, that don't even match the reality of the threat, you're just accepting it to try to have a chance to reopen. You're allowing someone to destroy your ability to make a successful living off a theoretical threat. You need to be informed. You need to become educated. You need to bring people together. You need to do everything you can, and you deserve to make a living. You deserve to be happy. You deserve to be able to provide a service for people. And we do need to try to do better as people. But it goes so far beyond coronavirus. If we can get people back on the page of, let's be intelligent, let's work together, let's help each other out, man, this could be a catalyst for change that could lead us to a much better world. Or this could be the biggest divide we've ever seen in the nation. Because like you said, I walked into Home Depot yesterday. I didn't have a mask on. With my friend, Master Juan Perez, who's 58 years old, we went to buy some paint. Where he's 58, wasn't wearing a mask. We were looked at by people like we're a threat. And I just, man, it's
It's heartbreaking.
It's heartbreaking because I'm walking around in America going,
Yeah.
This is just not it, man. This is not the idea of freedom. This is not the idea of.
And I think it's just the key is those people, I don't think they're bad people.
No.
They just don't know.
100%.
They just don't know.
If you are on the exact opposite side of this argument as me, I do not in any way think you're a bad person. I don't think that you're incorrect. All I'm telling you is please be educated, be informed, look at all of the subject matter, and try to be intelligent as you can, and realize that everybody is trying to make difficult decisions. Have some compassion.
Don't get all of your information from the mainstream media. Don't get all of your information from Facebook. You really got to, like he said, talk to some experts, talk to people who know, talk to some medical professionals, talk to people that have been working in the hospitals, talk to people who are health experts. There is a lot to be learned and a lot to know, and then make your decisions. And that's
a certain advantage that I had that a lot of people don't have is I have such an unbelievably large network. I was able to just flip through my phone and go doctor, state representative. You know what I mean? So I could quickly start getting in touch. So if you're not one of those people, reach out to people that have spoke to them. Like if anyone reaches out to me, I will gladly put you in touch with the doctors I spoke to, the nurses. I will give you my resources 100%. If you're like, hey, I'm about to make a tough decision, I want to feel a little bit better about it, just get in touch with me. I'm more than happy to help anybody.
Well, let me ask you this, James. Now I'm going to give you an opportunity to plug you, your company, and how people can get a hold of you. So look at this camera and tell our folks how they can find you on social media, website, phone number, whatever you want to give out.
Yeah, if you want to follow me on Facebook, it's just James David Gray. Instagram, it is Jim Jitsu, like jujitsu, but Jim Jitsu 87.
That's clever.
It's good,
Solid
right?
handle.
Good. I just recently started a YouTube channel, got a couple hundred subscribers that have been tuning in. You can follow me on YouTube. Other than that, if you want to follow the business, it's either Team Scorpion Fighting System on Facebook or the Michigan Institute of Athletics. Our website is instituteofathletics.com. We give everybody a free week. I don't care your background, what fitness level you have, whether you want to be a top-level professional athlete or you just want to get yourself in better shape or bring your family in and have a place to work together. We're here for everybody. So we try to be the best in every way across the board, and we're always in a process of learning. So we encourage new people to come and check us out or reach out to me at any time. My phone number is 517-420-7555. Shoot me a text. If you call me, I'm probably not going to answer because I have a million things every day that I'm doing. But if you shoot me a text and say, hey, James, this is who I am, I'm really looking for some information or some guidance or, interested in your fitness facility, I am there to help you out. So I appreciate you guys for having me here today.
Yeah.
And
thank you, James, for being on the show. Zach, you got anything for James?
Thank you.
That's it?
That's it. Thank you.
No,
we're going to work out, Zach.
Zach, I don't want to hear try. Take that word out of your vocabulary. Do or do not. There is no try.
We're going to do it. All right, James, thank you again for being on the show. Listen, if you're still listening and still watching, thank you for watching our show today. I encourage you to do your research. Don't just listen to everything you're told. Even that includes what you were told today. Do your research. Back it up. Make your own decisions. But most importantly, let's support each other. Right now, during this time, we have to support each other. We have to understand that people are at different, varying levels of comfort and fear. And it's our job as fellow humans to pick each other up, to support each other, to help each other as much as we can. Don't look at somebody across the aisle of an issue and say, that person is my enemy. Talk to people. Look them in the eye. Have a conversation, especially right now when you feel like you're not allowed to be around people. If you see something they posted on Facebook that made you feel a certain kind of way, give them a call. Send them a message. Don't just be quick to judge them. If you see or hear something that they did or went to or said, give them a call. Tell them how you feel about it. Ask them what their feelings were. And I guarantee you that a lot of those feelings that you're having will be resolved with great conversation and great communication. Again, thank you for joining us today. As my mother always said, you can't and never could until you tried. So go out there and try something great, my friends, and don't take the easy way out. We'll see you next time.